Okay, so I'm absolutely excited that everyone is a space nerd given the Artemis 2 space launch. And something that really stood out to me that I think is worth talking about is during the course of this mission, they actually did a CPR simulation yesterday. Now, we don't have footage from the actual simulation, but they did demo it during one of the Q&A sessions, just a brief version of it, not the official. But I think it is important to talk about the differences between CPR that happens here on Earth and in space. The first thing I want to lead off with is that for every minute CPR is not performed on someone who has encountered cardiac arrest, mortality rate goes up by 7 to 10% every single minute. So CPR is important. It saves lives. If you're not certified, do it. So, what are the differences between CPR on Earth and in space? Well, in space, obviously, you have microgravity, and so that presents a challenge. Here on Earth, you use your body weight and an assist from gravity to push down on the chest. You can't really do that just floating in space, right? You would essentially be pushing the patient away from you. And so, how they deal with that is you essentially strap the potential patient down, and then you brace yourself against a wall or a roof, and then you push on the chest. Now, another key difference is you get fatigued easier. There's no gravity to kind of assist your force in pushing into that chest. And so, what's going to happen is quicker fatigue. You may have to switch those who are performing the compressions much quicker. The other kind of method to do it is almost a bear hug method. And so, essentially, you would bear hug the patient, and your feet and your legs would essentially serve as the support as you kind of push into the chest, and you would be floating around in space. Less ideal than kind of the strapped down method. But really cool that CPR is something that is happening. I actually got a chance to spend some time with all four of the Artemis astronauts a couple years ago for my STEM show. And one of the things that they talked to me about was all the medical training they get. So they're basically EMTs, EMT pluses. They had gone to one of the big hospital systems here in Houston, to the medical center, to spend a couple days in the emergency medicine program in the ER. So they know how to suture, they know how to intubate, they know how to use an AED and perform CPR. And that was just one of the things that they were kind of going through a trial run for. Obviously, something hopefully they will never have to use, but they have to kind of know how to do all of that. Also, with one of the missions that had to come back earlier, not to the moon, but one of the SpaceX missions where the folks were on the International Space Station, one of the astronauts had a TIA and they had to come back quicker. And so medical emergencies do happen, and I believe that was the first instance of them actually having to cut a mission short because of a medical emergency. Thankfully, that astronaut ended up being okay, but they are trained in all of these sort of things, and really exciting to kind of see that happening, and to use it as an opportunity to tell people on Earth that, hey, CPR is important. It saves lives. Get CPR certified. Go to heart.org, find a course near you. But just wanted to share my thoughts on that.